So I will guide you through what we did in the medical imaging studies and reports team. The very last meeting we had, like 2 weeks ago, I think, if I'm not mistaken, yeah. we asked the team, like, if you have to describe our team or the experience the past 2.5 years and have to compare it to a vehicle, what would it be? And here you can see the results. So it goes from a tank to like a spaceship and everything in between. And I'd like to highlight a bit the train because I think that resonates most, at least my personal feeling, because the train is running and sometimes people on board and some people jump off at some stage. That happens. And we had several stops. You can visualize these as the milestones. And we also took some time sometimes to reflect, like, are we still on the right track or should we go a bit left or right? But in the end, the train kept on running and we reached the end destination. So, and I will show you what we have achieved. So this is a busy slide, but I think the most important here is that for the scope and the context we are working in is really the empowering of the patients. So having the medical imaging studies and the reports available for patients on the moment they need it is really in focus of our team. But also for the healthcare professionals, and we had people in the team with a clinical background that really estimated also this, is finding the right diagnosis. And in some cases, you really need to have the image available, and sometimes also the previous ones to be able to compare different situations. Or, for example, in a tumor, you have to see if it has grown or shrunk. So this was really in the heart of our work. We also set up the specifications for cross-border as well as national level interoperability. That was always on our mind. And in really terms of the technical scope, all DICOM recorded objects were in scope. And this means that in terms of the imaging studies, we have really covered a variety of specialties. So from radiology to dental medicine and gynecology. So really a broad array of specialisms. So what were the key challenges? Of course, just the fact that we are covering two documents, in fact, two types of documents. We have the images themselves, but also the report that accompanies the image. The alignment was quite a challenge because we were looking for cooperation with, for example, HL7 Europe, FHIR team, but also the IHE radiology team, and I will come to that a bit later. But also within Xt-EHR. In the previous session, I highlighted the alignment efforts we did on the use cases, but in fact, on all different levels, we had the need to align. We had a lot of discussions on the interpretation of the EHDS, like what is exactly meant, because it's like regulation text, it's not very specific. So we had a lot of discussions on the real meaning. And the last challenge is defining functional specifications without making explicit choices, because in the field of images, there are a lot of standards already in place, but different flavors, if you will. And in this area, you need to have the right experts who know, what about the IHE profiles, the FHIR guides, etc. And these people are not very, they are not a lot. So we really had troubles finding all the right people, and we were lucky to have them in the team, and also review the specs. And now we go to the more optimistic part. So what did we achieve? And I have to explain that we did our work in 4 sub-teams. So every team had like a dedicated topic. We had one sub-team working on more the general chapters, one team working on the use cases, one sub-team on the model, and one sub-team on the more the technical part, so the functional and technical specifications. And in the team working on the use cases, it was really a diverse team. And we had like 4 or 5 people with clinical backgrounds from Cyprus, from Czech Republic, Germany, from Norway. And that really helped a lot to check if what we were describing was really could be happening in real life, actually. That was really important input. But we also had people with industry background. So also from the EHR vendor perspective, we could challenge ourselves, like, is this really implementable, what we are asking here? So yeah, I was really happy with this strong team. And also the stakeholder input was helpful. Like Hinek just mentioned, we also received quite a number of comments. If I remember correctly, 250 were on the use cases. But that helped us really to improve the descriptions of the use cases. And by sometimes the stakeholders have put questions in their comment, and that, yeah, it challenged us, like, to think about it. This question is here for a reason. So let's try to answer this question. So in the end, we came up with 5 use case descriptions that I think are really, I dare to say they prove a solid basis. So the other sub-team was a team working on the information model and the FHIR. And this was a small team, very agile, and was in close contact with the team working on the common models. So if there are any concerns or questions, they could check really quickly and see, like, should this be incorporated as a common or not? And the same applies to the contact with the FHIR, the imaging report FHIR team of HL7 Europe. This team has weekly meetings on Tuesdays. It's still running. It's an open community, so I also would like to say here, if you are interested, you are welcome to join, because the team will consist to exist. And there was a transparent way of working via GitHub, where we could trace and document all the changes we made. And it was transparent for the other teams as well. And this was not only for the imaging team, of course. This was a general Xt-EHR approach, which I think worked really well. So the logical information model parts were translated in the FHIR implementation guides, and that's the picture that you see here in the screen. I also would like to highlight that working on the functional specifications, we discovered that we needed something that was not existing yet. And that was the manifest-based access to DICOM objects. It's really technical. That's a way to have information on the images, because you are all aware, I guess, that the images are really big files, and you don't want to have those images transported via a network, because it takes a lot of payload of the network. So this provides a means to have some metadata on the images, and for healthcare professionals, they can then select, like, oh, I want to see these and these and these, but not all of them. And they can really specify which image to transfer to their system. And this new IG profile, Madhu, supports both the DICOM way of doing this and the FHIR way. And that's the new thing about it. So this was work done together with the IHE radiology team, which is actually an international team. So it's not only European, but also the profile that has been set up is an international one. And I'm really happy to say that this was tested in the Brussels Connectathon, mentioned already a couple of times as part of the extended EHR projectathon. And there were 6 really big EHR vendors who tested this and think, yeah, this could work for us. So this is bridging already from the functional part of things to real life practice. And what's left for us as a future work? We will, of course, continue our work on the logical information models, just the fine-tuning of the value sets that was already mentioned a couple of times. That will take place in the task force on preferred code systems. Also, like every standard, it needs maintenance. So the imaging report via IG sits in the HL7 Europe group, but also the MADO profile will be maintained by IHE Radiology with input from European experts, of course. Yeah, so my message here today, and I'm really happy that I heard it said by quite a number of people already, that we should foster this community that we have established of experts to keep our engagement for further developments, because we are not really ready. I think as a project we delivered really good deliverables, but it needs some more fine-tuning and really to meet the needs of the real life practice. And that's the end of my part. Thank you.